Cancer sucks. This is the slogan for many families whose children are fighting the odds against pediatric cancer. Meet Lily. Lily is 3 years old, and she is depicted in this picture as a warrior princess with her army behind her. She truly is a warrior princess. At 3 years old, she is the only known survivor of her form of cancer, Ewing sarcoma. She is one of a kind. She has had to fight tooth and nail from the time she was born in order to get where she's at. She is the example of never giving up hope despite all the odds. I tell you Lily's story because, like her, thousands of other children are fighting pediatric cancer, and they are fighting against many odds. There are many forms of childhood cancer: neuroblastomas, retinoblastomas, brain tumors, and bone cancers. But the most common form of childhood cancer is acute lymphoblastic leukemia, or ALL. Each year, there are approximately 15,700 parents who will hear the words, "Your child has cancer." That's about 43 children a day. That's more than a classroom full of kids each day. And today, there are more than 40,000 kids fighting cancer. Cancer affects all ages, ethnic backgrounds, and socioeconomic classes. It knows no bounds. Here are just a few statistics about childhood cancer. The average child is diagnosed at 6. 74% of children who have cancer will have chronic illnesses. 60% of children who survive cancers will suffer what are called late effects, including infertility, heart disease, and other secondary cancers. 25% of all kids who get cancer will die. There's much research being done on childhood cancer. In some ways, chemotherapy works better for children because it can be given in a shorter amount of time in higher doses before the effects really show. However, with that being said, there are often unwanted side effects from the chemotherapy that children have to endure. Because their bodies are still growing and developing, the chemotherapy messes with their developing organs. The side effects may happen right away, or weeks, or even years later. Cancer treatment can always affect how a child grows, and secondary forms of cancer can occur. That is why all children with cancer will have a lifetime of appointments, follow-up appointments. As a country, we need more research done on how to better treat little ones with less side effects. Here are a list of some of the side effects that occur when your child gets cancer: constipation, diarrhea, fevers, mouth sores, dry mouth, low platelet count, low red blood cell count, nausea, vomiting, skin changes, weight gain or loss, and pain. They definitely go through pain. I have the privilege of working with these little ones every day as I work for a nonprofit organization called Anything Can Be. The picture I showed you in the beginning of Lily is what our company is all about. We use the art of photography to create lasting memories for each of our cancer children living out their dreams. Their dreams can be anything from being a dragon rider, a baker, a professional soccer player, or even a jazz basketball player. Each child's dream is unique, so along with taking their picture and giving that to the family, we also try to do a unique opportunity for them and an experience that is unique to their dream. I would like you to meet a couple more of our children. This is Sarah. Sarah is 13 years old, and she is suffering from acute myeloid leukemia, which is a form of ALL, but it's a little bit different. Right now, she's in the stages of remission. She is truly a survivor. Meet JP. He's 5 years old, and his dream was to become a professional jazz basketball player. He had the opportunity to go to the jazz arena, meet the players, and even play on the field with them at one of their preseason games. JP also is in remission and is cancer-free. Unfortunately, not all of our kids survive. Of the 25 children that we've had the privilege of working with, 4 of them have been lost. But the pictures we have given the family is a great reminder to them that their children are now living out their dreams in heaven. As a society, I hope that through our project, we will help individual children and we will reach those that can do more research and help these pediatric children with cancer.